Hello. Pull. Oh. Ooh. Yeah. Woohoo!
A few moments later.
Ankylosing spondylitis. Ankylosing spondylitis is a type of arthritis that causes inflammation in the joints and ligaments of the spine. Ankylosing is derived from the Greek word ankylos means group and cis means angle. And spondylitis is derived from the Latin word spondi means spine and a suffix luces means problem. Ankylosing spondylitis has no specific cause, but through genetic factors seem to be involved. The symptoms of ankylosing spondylitis is back pain and stiffness, pain and swelling in other parts of the body such as hips, knees, and ribs, fatigue, and this can occur in the neck, shoulder, hip, and thigh. Next is ankylosing. Ankylosing is the immobility of a joint, means fused bones or other hard tissue. It is stiff and rigid. So, it is also the same from ankylosing spondylitis. Arthritis is inflammation or swelling of one or more joints. Arthritis is derived from the Greek word arthro means joint and suffix of itis means inflammation. The causes of arthritis is by a fault in the immune system that causes the body to attack its own tissue in the joints, and it may be inherited genetically. The affected area of arthritis is wrists, knees, ankles, elbows, and shoulders, and it can affect many parts of the body.
Chondrosarcoma is a type of bone cancer that starts in the cartilage cells. But what is this cartilage? It is the specialized gristly connective tissue that is present in adults, and it is the tissue that from which of the bones develops. It also plays an important role in the growth process. And chondrosarcoma primarily affects the cartilage cells of the femur or the thigh bone, the arm, pelvis, knees, and rarely in the ribs. Chondrosarcoma is the second most common type of primary bone cancer in adults, which rarely affects individuals who are under the age of 20, and the risk rises up until the age of 75. According to medical studies, the exact cause of chondrosarcoma is unknown. Symptoms of this may vary depending on the location of the malignant tumor. However, the following are the most common symptoms of chondrosarcoma. Number 1. Large mass on the affected bones. Second, feeling pressure around the mass. Third, local swelling. And lastly, the pain gradually increases over time and usually worsen at night time. Curvature of the spine. It is the abnormality of the spine wherein the natural curvature of the spine is misaligned or exaggerated in some certain areas. There are three types of curvature of the spine. Number 1 is lordosis. It is also called the swayback, wherein the spine of a person with lordosis curves significantly inward at the lower part of the back, giving a backward leaning appearance to a person with lordosis. Number 2, or second, is the kyphosis. It is characterized by an abnormally rounded upper back or the thoracic part of the spine with more than 50 degrees of curvature. It can also occur in the lower back or in the lumbar part of the back. 3, or lastly, the scoliosis. It is a side-to-side curvature of the spine that can develop in adults when they are facet joint and these begin to deteriorate. When the joint deteriorates, the spine bones will tilt and begin to shift to the other side. which causes an S-shape or C-shaped curve. Because of the curvature of the spine is, as we go older, our bones undergo the degenerative changes that are part of the natural aging process. When joints deteriorate, arthritis can develop and the spinal column can shift sideways. Other conditions that might cause curvature of the spines are number 1, arthritis. Number 2, osteoporosis or loss of bone mass and vertebral compression fractures. Number 3 and lastly, previous spine surgery or adjacent level disease. And in some cases, it can also occur in teens or adults because of the improper posture while walking or sitting. Symptoms of curvature of the spines are 1. Curved posture, 2. Difficulty sitting or standing, 3. Difficult in walking due to loss of leg muscle or coordination, 4. Humpback, 5. Leaning towards one side, 6. Nerve damage, causing weakness, numbness, and pain in legs and feet. Number 7. Protruding rib, reduction in height due to curved spine, shortness of breathing, and fatigue caused by an upper spine curve. And lastly, spinal stiffness. Degenerative joint disease, also known as osteoarthritis. It is the most common type of arthritis out of all the arthritis. It develops due to the deterioration of the cartilage, specifically in the articular cartilage or also known as hyaline cartilage. But what is articular or hyaline cartilage? It is a rubbery smooth tissue that is found at the end of the bone within a joint, which plays a huge role in allowing the body to move our joints without any stiffness and any pain. We can see in the picture above the articular cartilage. It is in the color blue. It is a tissue that can be seen at the end of the both bones in the joint. So here we have a joint which is two bones coming together. At the end of the bone we have our hyaline cartilage or the articular cartilage. We can see here that it's plentiful and there's a lot of it and it is nice and smooth. This cartilage acts as a protective gear by providing a slick surface for our bones to slide and glide or to move freely without the person feeling any pain at all. And this cartilage also absorbs shock whenever we move. Now, let's have a look at a healthy joint and a joint with osteoarthritis. Here above, we can see that the cartilage, a smooth tissue, is present, and a lovely gap or space between the bones is evident. But when we examine the osteoarthritis affected joint, we can see that the lovely space between the bones is almost completely gone, causing the bones to rub against one another. And that means that both the inside and outside of the bones will be affected because the bones will be grinding and rubbing against one another. If that happens, the bone will break down and create bone spurs, or what are known as osteophytes. Additionally, the inside of the bone will experience sclerosis, which results in abnormal hardening of the bone. Chronic repetitive motion that damages structural joints and causes inflammation is the underlying cause of this condition. Symptoms of degenerative joint disease or osteoarthritis are: number 1, pain. The affected joint might hurt during or after a movement. Number 2, stiffness. Joint stiffness might be noticeable upon awakening or after being inactive. Number 3, tenderness. Your joint might feel tender if you apply light pressure around it. Number 4, loss of flexibility. You might You might not be able to move the joint through its full range of motion. Number 5, grating sensation. You might feel a grating sensation when you move the joint. You will hear a popping or cracking sound when you move it.
I'll be taking over. Thank you very much. I'll be reporting fracture, gout, herniated disc. But first of all, I would like to introduce myself. My name is Mark Adrian Soriano. I'm 19 years old. I'm from Medical College of Northern Philippines. So first, what is a fracture? A fracture is simply a break in a bone. A fracture can be complete and incomplete. A complete fracture meaning the bone is completely broken into two pieces, and incomplete meaning the bone is cracked but not completely broken. Fractures can also be classified into two. It's open or closed fractures. An open fracture can occur when the broken bone is piercing through the skin, while the closed one is broken but not piercing through the skin. The symptoms can vary depending on the location and the severity of the break. However, some common symptoms include pain, swelling, bruising, and deformity of the affected area, difficulty moving. The most common causes of fractures are trauma. This can include the fall, car crashes, and the injuries you can get from the sports. Overuse. This can lead to stress fractures, which are small cracks in the bone that can develop over time. And some cases, diseases can also increase the risk of having a fractures. In some cases, diseases can also increase the risk of having a fracture. This includes osteoporosis and cancer. Other medical conditions such as rheumatoid arthritis and diabetes can also weaken the bones and make them more likely to fracture. A gout is a type of arthritis that causes sudden intense pain, swelling, and stiffness in one or more joint. It causes by the buildup of uric acid crystals in the joints. Uric acid is a waste product that is formed when the body breaks down purines, which substance is found in many foods and drinks. So if you're drinking and eating foods that contains purines, you may have the high chance to get a gout. The most common symptoms of gout is a sudden severe attack of pain in the big toe. Other joints that can be affected include ankles, knees, elbows, wrists, and fingers. The pain is often described as throbbing or stabbing, and it can be so severe that it's difficult to walk or move around the affected joints. Other symptoms of gout include swelling, redness, and pain, decreased range of motion, fever, chills. Gout attacks typically last for a few days to a week. However, without treatment or without seeking treatment, attacks can become more frequent and severe. The causes of a gout is a buildup of uric acids that you can get from foods and drinks. This can happen in the body produce too much uric acid, or if the kidney do not excrete enough uric acid. There are a number of factors that increase the risk of developing gout, including the diet. Eating foods that high in purines, such as red meat, seafood, and organ meats, can increase the uric acid levels that can increase the high risk of a gout. Obesity. People who are obese are more likely to develop a gout. Medical conditions. Certain medical conditions such as diabetes, high blood pressure, and chronic kidney disease can increase the high risk of getting a gout. A herniated disc. Herniated disc occurs when the soft jelly-like center of spinal disc pushes through a tear in the upper outer ring of the disc. In a spine is a group of bone called vertebrae that stacks together, and between those vertebrae there's a jelly-like substance called spinal disc. If the center of the disc pushes through a tear in the upper outer ring of the disc, this can cause an irritation or compress nearby nerves, causing pain, numbness, and weakness. Herniated discs can occur anywhere in the spine, but they are most common in the lower back and neck. The symptoms of herniated disc. Symptoms of herniated disc can vary depending on the location of the herniation and the nerves that are affected. Common symptoms of herniated disc. Symptoms of herniated disc can vary depending on the location of herniation and the nerves that are affected. Common symptoms may include pain, numbness, or tingling that radiates down one and both legs or arms. Muscle weakness reflects changes and difficulty with bladder or bowel control in severe cases. Causes of herniated disc. There are a number of factors that can contribute to the developing of herniated disc, including aging. As we age, the spinal discs become less hydrated and more prone to injury. Genetics. Some people are more likely to develop herniated disc than others due to their genetic makeup. Occupation. People who work in jobs that require repetitive lifting or bending are most likely to develop herniated disc. Sports and activity. Certain sports and activities such as weightlifting and football can increase the risk of developing herniated disc. Obesity. Obesity puts additional stress on the spine which can lead to the risk of developing herniated disc. Smoking. Smoking damages the disc in the spine, making them more likely to herniate.
So now let's proceed to kyphosis. Kyphosis is an exaggerated curvature of the spine in the thoracic region's sway back. It is a spinal condition wherein it is characterized by an excessive forward curvature of the upper mid-back or the thoracic region. This condition affects the curvature of the spine, specifically in the thoracic area that leads to a rounded or sway back appearance. Now let's proceed to symptoms of kyphosis. Kyphosis may have no specific signs or symptoms, but some have impaired posture, spinal deformity, chest deformity, neck pain, backache, limitation of spinal mobility, disorders of the internal organs, and fast fatigability. And also, this medical condition can cause by various factors. These factors can be spinal infection, muscle weakness, back injuries, ankylosing spondylitis, poor workplace ergonomics, degenerative arthritis, birth defects, and osteoporosis. Next is the lordosis. Lordosis is an excessive inward curvature of the spine, primarily in the lower back or the lumbar spine or neck in the cervical plane. So there are symptoms of it, and it includes the violation of the heart, lungs, and gastrointestinal tract, stretching the muscles and ligaments of the spine, impaired posture, compression of the internal organs, fatigue, pain and deform of the spine, metabolic disease, and violation of the normal structure of the spine. So let's proceed to the causes of it. Doctors do not always know why lordosis develops, but there are certain causes of it, such as obesity, osteoporosis, spondylolisthesis, postural lordosis, neuromuscular lordosis, post-surgical lordosis, and secondary lordosis.
Hello everyone, I am Alejandro Maborangiter from BSN 1K. Today I'm going to discuss to you about the symptoms and causes of osteoarthritis, osteogenic sarcoma, and osteomalacia. Let's discuss first the osteoarthritis. Osteoarthritis is a degenerative joint disease in which the tissues in the joint break down over time. It is the most common types of arthritis and it is more common in older people. So what are the possible symptoms of osteoarthritis? Here are some. First, pain when using the joint, which may improve with rest. For some people in the later stages of the disease, the pain may be worse. Pain can be localized or widespread. Second, joint stiffness, usually lasting less than 30 minutes in the morning or after resting for a period of time. Third, swelling. Swelling in around the joint, especially after a lot of activities or use of that area. Of course, we have the causes. First, being overweight or obese. Second, history of injury or surgery of the joint. Lastly, overuse of repetitive movements of the joint. Next, let's discuss about the osteogenic sarcoma. Osteogenic sarcoma, it is the most common primary tumor of the bone, found most commonly in the extremities with bidomal age distribution. So here are some symptoms of osteogenic sarcoma. First, pain. You might have pain or tenderness most of the time, even when you are resting. Second, we have swelling. You might have some swelling, but it is not always possible to see or feel a lump. Third, feeling tired always or fatigue. Lastly, weakened bones. So let's discuss the causes. First, the swelling. Second, bone or joint pain. Third, bone injury or bone break for no clear reason. Or and based on the research, ang osteogenic sarcoma ay namamano po ito. Lastly, we have the osteomalacia. It is the disorder of the bone softening in adult that is usually due to prolonged deficiency of vitamin D. So what are the symptoms? Here are some: difficulty walking and change in how you walk, possibly with a waddle. Second, bones that break more easily, particularly those in the hips, lower back, and feet. Third, we have muscle pain and weakness, particularly when following exercise. And lastly, pain felt in the bones and joint. And here are the causes. First, kidney failure. Second, limited sunlight exposure. And lastly, celiac disease. And now let's proceed to the symptoms and conditions of hemarthrosis. Hemarthrosis, it is a bleeding into a joint cavity. This can occur after an injury or more commonly in bleeding disorders such as hemophilia. Patients will typically present with pain, swelling, and a decreased range of motion of the involved joint. Second, leg calf paralysis. It is a rare condition in which the ball-shaped head of the thigh bone or femoral head temporarily loses its blood supply. As a result, the head of the thigh bone collapses and the area becomes inflamed and irritated. Lastly, we have the multiple myeloma. Is a blood cancer that develops in plasma cell in the bone marrow. The soft spongy tissue at the center of your bones. In healthy bone marrow, normal plasma cell makes antibodies to protect your body from infections.
Osteomyelitis. Osteomyelitis is inflammation or swelling that occurs in the bone. It can result from an infection somewhere else in the body that has spread to the bone. Or it can start in the bone, often as a result of an injury. Osteomyelitis caused by bacteria or fungi. It causes painful swelling of bone marrow and the spine. And the symptoms of osteomyelitis includes fever, swelling, warmth, and redness over the area of the infection. Next, osteopenia. Osteopenia is a condition happens when your body gets rid of more bone than it is creating. And the causes such as prednisone, heartburn, high blood pressure, and seizures. Lastly, osteopenia usually has no symptoms and is frequently not detected unless a person has a bone density test. And the last one, osteoporosis. Osteoporosis is a bone disease that develops when bone mineral density and bone mass decreases, or when the quality or structure of bone changes. Osteoporosis causes silently weakens your bones, which can make you more likely to experience a bone fracture, or we called it broken bone. Symptoms of this caused by a broken or collapsed bone in the spine. Loss of height over time.
I'm going to discuss the Paget disease, pot disease, and the rheumatoid factor. So, the Paget disease is an abnormal bone structures caused by the osteoblast. So, before I discuss that, I give you an informations. There's our bone tissue regenerated throughout life and regenerated called a bone remodeling. And bone remodeling has two cells called osteoclast and osteoblast. The osteoclast is to break down bones and the osteoblast is to form a new bone. So, in this case, there is a lot of osteoblasts that remodeling um, growing a lot of new bones that we don't need. So when the Paget disease is confined in our skull, um, there are being large or growing a lot of bones in our head. So the symptoms are we are losing our visions and our hearing. Sometimes there's not just in our head. We can also see at the kyphosis and lower lumbar, pelvic, and others. We can see at these photos that in this yellow part, that are the part that Paget disease has been affected, or the Paget disease affect that bones. I'm going to discuss the pot disease. The pot disease or tuberculosis of the spinal cord. Tuberculosis of the spinal cord is caused by the osteoclast, because osteoclast is slowly eating away the bones in our spinal. So the result will be it is start to bend down like this. You can see at the pictures that the bone is start to bend. Then symptoms of pot disease is pain in the back that we cannot handle. It may cause the pain for at least 2 to 3 months. You may feel the pain. So some of the symptoms may you are losing weight, or you are not feeling well and you don't want to eat. Rheumatoid factors or rheumatoid factor test alone has a very little weight in the diagnosis of rheumatoid arthritis. Whether to confirm that the diagnosis it is positive or to exclude the diagnosis if it's negative. On it extent, the patient think you can have a positive test and we will tell you that it's not true. It's not true or to forget it. So, rheumatoid arthritis is based on symptoms, not the test. And so, doctor asks you for the symptoms, ask you if what you feel, or based on your what you said. That is where they can see if you had a rheumatoid arthritis.
Rickets is the softening and weakening of bones in children, usually because of an extreme and prolonged vitamin D deficiency. Rare inherited problems also can cause rickets. Signs and symptoms of rickets can include delayed growth, delayed motor skills, pain in the spine, pelvis and legs, and last, muscle weakness. Because rickets can soften the areas of growing tissues at the ends of a child's bone or growth plates, it can cause skeletal deformities such as bowed legs or knock knees, thickened wrists and ankles, breastbone projections, causes of lack of vitamin D. Children who don't get enough vitamin D from these two sources can develop a deficiency. First is the sunlight. Your child's skin produces vitamin D when it's exposed to sunlight. Food. Fish oil, egg yolks, and fatty fish, such as salmon, contain vitamin D. Vitamin D has also been added to some foods and beverages such as milk, cereal, and some fruit juices. Sciatica refers to pain that travels along the path of the sciatic nerve. The sciatic nerve travels from the lower back through the hips and buttocks and down each leg. most often occurs when a herniated disc or an overgrowth of bone puts pressure on part of the nerve. This causes inflammation, pain, and often some numbness in the affected leg. Symptoms is sciatica pain can be almost anywhere along the nerve pathway. It's especially like to follow a path from the low back to the buttock and the back of a high thigh and calf. The pain can vary from a mild ache to a sharp, burning pain. Something it can feel like a jolt or electric shock. It can be worse when coughing or sneezing or sitting a long time. Usually, sciatica affects only one side of the body. Some people also have numbness, tingling, or muscle weakness in the leg or foot. One part of the leg can be pain, while another part can feel numb. Causes of sciatica occurs when the sciatic nerve becomes pinched. The cause is usually a herniated disc in the spine or an overgrowth of bone, sometimes called bone spurs, from on the spinal bones. More rarely, a tumor can put pressure on the nerve or a disease, such as diabetes, can damage the nerve. Scoliosis is a sideways curvature of the spine that most often is diagnosed in adolescence. While scoliosis can occur in people with conditions such as cerebral palsy and muscular dystrophy, the causes of most childhood scoliosis is not known. Uh, Children who have mild scoliosis are monitored closely, usually with x-rays, to see if the curve is getting worse. In many cases, no treatment is necessary. Some children may need to wear a brace to stop the curve from worsening. Others may need surgery to straighten more serious curves. Symptoms. Symptoms of scoliosis may include uneven shoulders, one shoulder blade that appears more prominent than the other, uneven waist, one hip higher than the other, one side of the rib cage jutting forward. Causes. Healthcare providers don't know what causes the most common type of scoliosis, although it appears to involve hereditary factors because the disorder sometimes runs in families. Less common type of scoliosis may be caused by certain neuromuscular condition such as cerebral palsy and muscular dystrophy, birth defects affecting the development of the bones of the spine, previous surgery on the chest wall as a baby, injuries to or infections of the spine, spinal cord irregularities.
Spondylolisthesis. Spondylolisthesis is a condition involving spine instability, which means the vertebrae moves more than they should. A vertebra slips out of place onto the vertebra below. It may put pressure on a nerve, which could cause lower back pain. There are types of spondylolisthesis. First, congenital spondylolisthesis, ischemic spondylolisthesis, degenerative spondylolisthesis, traumatic spondylolisthesis, pathological spondylolisthesis, and lastly, post-surgical spondylolisthesis. What causes spondylolisthesis? Overextending the spine is one of the main causes of spondylolisthesis in young athletes. Genetics may play a role too. Some people are born with a thinner vertebral glow. In older adults, wear and tear on the spine and this can cause this condition. What are the symptoms of spondylolisthesis? You may not experience any symptoms of spondylolisthesis. Some people have the condition and don't even know about it. If you do have some of the symptoms, lower back pain is typically one main. The pain may extend to the buttocks and down to the thighs. You may also experience muscle spasms in the hamstring, back stiffness, difficulty walking or standing for long periods, pain when bending over, numbness, weakness, or tingling in the foot. But Take note, spondylolisthesis is a common cause of back pain, but it's not dangerous and doesn't need a takeover of your life. Many treatments are available, from medication and physical therapy to spinal surgery. If you have low back pain or find it difficult to walk, stand, or bend over, talk to your healthcare to find out on how you can feel better. Spondylolysis. What is spondylolysis? Spondylolysis is the medical term for the small crack, fracture between two vertebrae in your spine. Your vertebrae are the 33 bones that make up your spinal column. A single bone in your spine is a vertebra. Vertebrae is the plural form. Healthcare providers sometimes refer to spondylolysis as pars defect or pars fracture because it affects your pars interarticularis, the tiny ridges of bone that link your vertebrae together. What are the symptoms of spondylolysis? Lower back pain is the most common spondylolysis symptom. The pain usually spreads or radiates from your lower back into your thigh and butt muscles or your buttocks. Feels like a muscle strain in or around your lower back. Also, gets worse during physical activity and improves with rest or when you're less active. Some people with spondylolysis never experience symptoms. These people may not only learn they have it when they have an imaging test for another reason later on. What causes spondylolysis? Damage to part of your vertebrae called the pars interarticularis causes spondylolysis. The pars interarticularis are thin pieces of bone that link your vertebrae directly above and below each other to form a working unit. These links let your spine move and flex. Anything that damages your pars interarticularis can crack them. Providers call these pars fractures. The most common causes of pars fractures include overuse. Repetitive motions that put stress on your lower back cause wear and tear on your vertebrae. Over time, this damage can add up to cause pars fracture. Next, growth spurts. Some kids and teens develop spondylolysis when they going through a growth spurt, a period when their bodies are physically growing and changing quickly. Genetics. Some people are born with thinner vertebrae. This can make you more likely to experience pars fracture.